Oh, Katie, how do you pronounce your last name?
Oh, Hauck.
Hauck. Okay.
Yeah.
Okay. I'm just moving my screen over so I have my notes in front of me.
Oh, that's smart.
I know, hey?
I have like paper notes out right now.
It's okay. Okay, Katie Hoke, I appreciate you being here today. I know that you recently spoke to the prostate cancer support group here in Kelowna, which made me think like let's continue this conversation on another platform because there this is an underserviced population that I don't think knows much about physiotherapy. And I have always tried to keep this podcast in mind for helping people get a bird's eye view of things. Like, we're not going to go into tons of detail about any one subject, but give people a bit of a showcase of what kind of we as pelvic health physios are able to offer. And today, with the audience in mind, men that go through prostate cancer and all the things they don't know about what physios do. So I appreciate you being here today.
Oh, thank you so much for having me.
Before we get going, can you please share a little bit about yourself so that everyone knows who you are, Katie?
Yeah. Like I said, my name is Katie Howe. I've been practicing as a physio for over 10 years now, but I've only recently moved to Kelowna exactly a year and was super happy and fortunate to be connected with you and Green Wade, who did your chat earlier on the podcast. So I've been working with her the past year at Care Physio. And then just currently, I'm opening up my own practice in Black Mountain called Black Mountain Physio. Uh, Starting out as a physio, I knew I always wanted to get into this specialty, really kind of breaking the taboos around topics of bladder, bowel, sex, and then throwing in the other taboo topic of the big C word or cancer.
Hmm.
I love speaking at different groups, and I feel like every time doing a talk, we'll definitely learn more about the topic.
Totally. I think we're lucky. Like, it's kind of neat when you think of the geography of Kelowna. Like, we're literally all starting to sprinkle all the way around Kelowna. Like, there's people, like physio providers in so many different corners of the city. And I think we're gonna talk a little bit more about that later in our discussion, like how to find a physio, because there's lots of us, and whether you ask around or look on different websites, there's lots of people here to support you. Um,
Yeah, it's definitely been growing for sure here.
Absolutely. And I think because there's so much more research coming out about like private parts, and physio is always landing so high in the research. So I think like we are seeing, like I'm sure I can speak for you too here, like we're seeing so many more referrals from people like surgeons or specialists because of what we have to offer, right?
Oh, definitely.
So in the episode before this one, I talk a little bit with a urologist about a little bit more detail around the specifics around the prostate and cancer and what to expect when it comes to symptoms, diagnosis, treatment, talk about surgery. And then I think what's going to come, people will hear from that discussion is that there's a lot of times referral to physiotherapy. So that's what I wanted to use this episode for. So people could have an idea when making a decision, maybe of whether or not they want to book an appointment, or getting an idea before they go to their appointment, what they can expect. Right. And so let's kind of give that bird's eye view, like I like to say, around what they can expect. So, for example, in that previous episode, we'll have talked about that, after their surgery or maybe before, the urologist, mentions physio. Quite often, I think in our community, what happens is the patient may be given a list of physios that work in the area. um they might find, and I think let's speak a little bit to like, how to find one that's right to you for you, right? Because there probably isn't just one in your community that you can see, but what do you have for recommendations, Katie, when it comes to how someone might pick a physio that's right for them?
Yeah, definitely. It's like the nice thing about having different physio options here is there's not always going to be that one right fit for that person. There's going to be different personalities and different approaches to treatment as well. Even coming from a big city, we're fortunate that there are so many physiotherapists. And even within that, there's going to be pelvic floor physiotherapists, but not every pelvic floor physio is going to be comfortable treating all genders. I think even Kelowna here, there's a few of us that do have that experience and comfort level. So really finding someone that has that comfort, is available, and then really working towards what are your goals. I know you kind of mentioned a little bit about surgery. I know in bigger city centers like Toronto and I think Vancouver, surgery does tend to be that option that they do lean towards. I think what I've learned from Kelowna and some of the support groups is in Kelowna, we're fortunate enough too to have really good research into radiation
Mm-hmm.
treatment for prostate cancer. So there's going to be different side effects from both and different things you're going to be looking for in the physio when you're looking towards treatment.
When people come and like make an appointment with us, we have some pretty lengthy forms that quite often you expect to fill out before your appointment. And just to kind of give an idea, I think one of the reasons we ask all those questions, I'm sure you'll agree, Katie, is that we want you thinking about all the things that can be related to your prostate or to the symptoms that you're having. So I think sometimes people don't even realize that, the issues with your prostate are also related to your bladder or to your bowel or to your sexual function. I don't think a lot of people know that. And sometimes it's a big surprise if, you ask all those personal questions in person. So I think that's probably one of our reasons to ask, but also too, like when we're looking through those intake forms before you come in, we're getting an idea of what to expect and possibly why you're experiencing those symptoms, so that we can further ask more. And like what we're going to get into a little bit today, Katie, is like some of the side effects of treatments like radiation and surgery. And so that people understand it's very normal to have some of these symptoms after your diagnosis or your treatment. So let's and I often find that you almost need to set the stage a little bit when people come in, and depending on their knowledge around the topic, or their confusion around why a physio is asking these questions, I always link to a different area of the body. Like I might say to them, you know, I appreciate that I'm asking you a lot of questions that possibly you've never talked to anybody about before, or you weren't expecting in a physiotherapy session. But similar to if you have just had an injury to your knee or a surgery to your knee, I want to know kind of what symptoms you're feeling from that, and what you want to get back to. And so to set the stage that way, and then say, I'm going to be asking you similar questions just in a different area of your body. Because I do find some people are just like, oh my gosh, where are these questions coming from? I've been to a physio before and they didn't ask such personal questions, right? And so I think, any other thoughts on that? I think that's a big part of our job at the beginning, is just to ease people's mind and give them an idea of why we're asking these questions, and it always needs to make sense, right?
That's very true, especially the pelvis. It's an area that we don't often really talk about. Like if you saw a physio for a total knee replacement surgery or even a shoulder injury, and you had a really great experience, you would be sharing and telling everyone about it.
Mm-hmm.
When it comes to bladder, bowel, sex, all those uncomfortable topics, we tend not to share in that same
Mm-hmm.
way. So really, like you said, setting that stage ahead of time for an area that we often don't even think about too. There are so many muscles here that normally they're automatically doing their thing. We don't have to think about how we pee or how
Mm-hmm.
we poop until we go
Mm-hmm.
through treatment for these areas. And now we're seeing side effects of something that we've never thought of. We don't know where these muscles are. Our brain actually has less connections to these muscles. So we've added on a really big challenge.
Mm-hmm. Absolutely. So let's say that you have someone coming in. to your clinic on a Monday or whatever, and you see that so and so's coming in and they've recently had prostate cancer, okay, or diagnosis or what have you. So, can you just speak to the listeners? What are some of the and you can go into details whether you wanted to like I know it depends whether radiation surgery, like different things you
Mhm.
would expect slightly different symptoms or different variations. Can you speak a little bit to some of the symptoms you would expect that this patient might be experiencing um, after they've had prostate cancer?
Definitely, yeah. There's a couple big symptoms that we tend to see from the treatment, whether it is surgery or radiation. And often our two big ones that we're navigating are bladder control
Mhm.
is definitely one of the most common, especially from the surgery route, because we're injuring, damaging nerves, and we're taking away the automatic control and now turning almost from an automatic transmission to a manual transmission. We're relying even more on these pelvic floor muscles that we haven't trained before. So bladder tends to be a really big one. Um, Even with radiation, we'll see similar amounts. It'll just creep up a little bit later, where surgery is often immediate. Our other big symptom that we often are working with is erection and sexual health. So erection quality or erectile dysfunction is something that we immediately see a change with surgery. And with radiation, it's something that does creep up a little bit over time. This is often from the men that I have seen kind of the most distressing symptom that we are experiencing or navigating.
Yeah, I think it's so different because I could say, I feel like there's just as many that are more stressed about the incontinence. Like it's never the same.
True.
Like when
Yeah.
it's never the same, it's, people will rank their problems so differently, right? And obviously, like this will depend a little bit on how soon we see them after, right? Kind of like what symptoms maybe they're experiencing. But can you talk a little bit too about like Peyronie's disease? Because some people, first of all, don't even know there's a name, but they'll just say my penis is crooked. So can you speak a little bit to, why, how would you explain to someone that possibly the treatments they had might be linked to that or associated with that?
Definitely, yeah. Pronies is often that less talked about side effects, which basically fancy word for scarring that's happening in the penis and creating a very painful curve. Um, with surgery, it's often a scarring from the procedure, or it can be things limiting oxygen to the tissues, which is then creating more scarring. And basically, with where the scarring is happening, it's going to create that painful curve. Radiation, any tissue that's in contact with that radiation is going to go through something called radiation fibrosis, which is also scarring.
Mhm.
Uh, I know when we think of pelvic floor physios, we often think about strengthening, or Kegels are going to be our number one treatment, which can be a very important treatment for the bladder control or erection quality. It might actually worsen or not be as effective when we have something like painful erections.
Yeah, absolutely.
Yeah.
And also too, like, wouldn't you say, like you said, you hit the nail on the head that, erectile dysfunction, incontinence, and then sometimes Peyronie's will come up a little bit later, and often not like right immediately. But who knows what else? Like sometimes I find that it's just like in a I don't obsession. I don't mean to say that in a negative context, but like a hypervigilance around, oh my gosh, everything's different down there. Sometimes bowel issues will show up. Sometimes even kind of pain in the pelvis that around my perineum or something. But I always describe to people that um, you know, this is something that causes a lot of stress. Like just a cancer diagnosis, let alone a surgery in an intimate area or radiation in an intimate area. I think just knowing that our muscles follow our nervous system. And all of this is more likely to create like a fight or flight response. And especially if you're already a little bit more susceptible to stress, absolutely your like just what you've been through can kind of exacerbate symptoms. And so I think, would you not say that our biggest job at the beginning is just kind of normalizing and helping people understand that of course you have these symptoms. Like I would expect these symptoms. And that's where like I use the parallel with the knee, similar to if you had recently had a knee surgery, of course you have pain and swelling and not full function. It's just that we're talking about a private area. And so I think that's our biggest job at the beginning is to just be like, okay, and that makes you normal, the fact that you have these things. Wouldn't you say?
Oh, definitely. Yeah. And because the pelvic floor muscles, they're so protective too,
Yeah.
that as soon as we are stressed or anxious about it, the muscles are trying to tense to protect us, but then that tension creates more pain. So we almost get stuck in that vicious cycle or loop of really trying, like, how do we break through that cycle?
Yeah,
What's our
absolutely.
strategies from there?
Absolutely. I find because obviously like we'll get into a little bit more detail around how we as physios kind of would help you approach some of these issues. But and we all practice differently. So I think kind of knowing that again, like every physio has different personality and a different way to approach things. So Katie and I are speaking here a little bit to like how we approach things. I'll kind of share first a little bit about what something that's coming up in my brain, and then I would love for you to add to what you think. But this is where I find quite often like you have to read the room a bit and see like where is this person at and where's their knowledge and are they really kind of having a hard time just understanding why they have this, or where do I need to start? And this is where I think we have to be very creative, whether it be models or images on our computer, or some of us are good drawers, not me. But just different. I have so many different props in my room, like balloons and toilet paper rolls and everything, to be able to help people understand, like, let me just help you visualize, how your pelvic floor relates to your prostate or relates to your symptoms, so that, first you can visualize it and understand it. Because, like you said earlier, these are such automatic functions that sometimes you just need to understand how it works so that we can figure out where to start, right? Instead of making it sound like we have all these things we need to do, just kind of meeting them where they're at first and helping them understand, okay, it sounds like, this is what, let's say, maybe a normal functioning system looks like, or this is how it should work. Now, this is what's happening with you. And I often kind of say to them, these are some different things we can start with. Where do you want to start? Right. And so, any other things, Katie, you would say that you like, where would you start? Again, we're picturing this person that's come in to see you. They've disclosed their symptoms. And, you know, w- anything else, anything else that you have to add that maybe you would start with? And I know we're keeping it pretty vague right now. Like, we haven't nailed down like what the actual person's symptoms are. And maybe that would be helpful. Like, if I, like, let's say this person had primarily incontinence, right? So, you know, we also have to keep in mind that it depends when they're coming in. So let's say they've come in, quite soon after a prostate surgery, let's say, and they're having a lot of incontinence. Like, can you just talk a little bit about incontinence and, where would you start with somebody?
Yeah, as you mentioned, lots of props, and
Yeah,
even for our talk today, I had
yeah,
brought out my pelvis and other props that I usually have on hand. Uh, I find because it's an area that we don't think about until we actually do have challenges and struggles, is anatomy and knowing our body. Knowledge is definitely power. So that's often a key point that we're starting at. Even before someone does come in, benefit of our super long, lengthy paperwork is already from that trying to get an idea of, okay, what might be the driving point for this person. Um, Bladder control, typically it's our number one challenge that we're starting with. Because the earlier we do start training those muscles, we're seeing a better effect from it or sooner improvement with bladder control. Uh, where was I going with that? bladder, bladder control. So yeah, even before the person comes in, we're looking at, okay, what's their posture? How are they sitting? Um, Posture can dictate what position muscles are going to be in. So are you getting their muscles in their best ready position to work for the person? Or is it taking it out of their strong position? What kind of activities are they wanting to get back to? What's their goal in the end? Typically, no pads is our sign of full bladder control, and that's all what we're aiming for. Um, there's a difference between, do I have full control when I'm just at home, sitting, lying down on the couch, or am I a mountain biker? Am I a skier? Often we see leaks happening when we're challenging those muscles and bladder, which is going to happen with some of those activities, or even things like getting up from a chair or things that are putting pressure down on the bladder. So I know starting like 10 years ago in this area, uh, with our treatment approach, there's often a bit of a misconception that there's always going to be an internal rectal exam, and that's how we're treating and training the muscles. 10 years ago, that was often our approach to how we train. Now that we're studying this more and learning more, it can be helpful information. There's a lot of information we can gather looking from the outside as well and
Absolutely.
train with
And
that.
what would you, because we also should talk a little bit about, like, again, this is not going to be the same for everyone, but when are you actually noticing people come to see you, like after treatment? Like, would you say, and again, this is going to depend on the clinician, but I do think that we could do better, and this is one of the reasons why we're doing this episode. But are you finding typically people are coming in really early, like soon after their catheter comes out? Are you finding that they're coming in later, several years, and they're still incontinent? Can you just speak to that a little bit?
Exactly. Yeah, I would love to see more people coming in even before
Yes.
surgery or radiation treatment. There's so much great evidence now, and we're seeing it more and more with the people that I have coming in as well. Is normally kind of like any other muscle in the body. We want to target that muscle, we want to strength train it. It usually takes about 3 months to build up that muscle after an injury. So, like a knee replacement, it'll take 3 months to rebuild the quad muscles. With a pre-op appointment, it's actually taking less time. We can get full bladder control in now 2 months instead of 3 months. Um, I feel like that's where we could be doing a little
Yeah.
bit better working together to start getting people coming in earlier.
Yeah.
Um, yeah.
Totally. I mean, he's just a use, and maybe you have an example too. I had a male client recently that was sent over by a urologist after like a radical prostatectomy. So he had his whole prostate taken out and was completely incontinent. Was getting a little bit better by the time he came in. I want to guess he was in at 4 weeks after, something like that. I don't remember the details right now. He was mainly concerned with the incontinence. He actually didn't want to talk about the erectile dysfunction. He just was like, "Do you know what? Let's talk about that later." So that was like again like a secondary thing for him. And we had to spend a lot of time. Like he felt a lot of swelling. Lots of positions were uncomfortable to be in, but we had to spend quite a bit of time just like for me to describe what the pelvic floor muscles around the urethra even felt like. And I think one of the reasons is because he was uncomfortable unless he was sitting back, if that makes sense. And when we sit back in our
Mm.
pelvis, it's a bit easier to recruit the muscles around the anus, which are also pelvic floor muscles, but they live farther back away from the pee hole, essentially. And like you described, Katie, like when they do the surgery, like we kind of have two different sphincters, right? We have an internal sphincter that we have no control over, and our external sphincter is our muscles. So we're trying to help you get the external sphincter, right? We're trying to help you, like you mentioned, like use like a manual transmission, like learn how to shift the gears or, learn how to recruit that power. And so that can be hard for people because, like you mentioned, they're automatic, right? And so, like, I often
Like an
tell
automatic
people,
car.
like an
very
automatic
easy to
car.
drive. Yeah.
Exactly. And so that's what we're trying to say is like it can be really hard to find muscles you've never thought about when you're in pain, when you have swelling and like in a stressful time, right? And so whereas finding or connecting with those muscles beforehand, and like let's be honest, we have to use a lot of interesting cues because like everybody will resonate with something different and it's not. I think you can go online and you can look at different ideas or you can talk to friends and hear what cues work for them. But my gosh, no two cues, no cue works for everybody. And so you have to be pretty darn creative um, with what actually
Or
works.
have a really amazing body awareness to start with.
Exactly.
But how many of
Exactly.
us have thought of our pelvic floor and actually know
Yeah.
what it's doing, even
Yes.
right now, sitting here?
Yes. And I think that this is the thing is like a lot of people associate physio with like recovery. And so I get why they come after. That totally makes sense that they would think about us after. And I honestly find that a lot of them book that appointment like exactly when they've been recommended. Like let's say the urologist says at 4 weeks or 6 weeks or whatever they say. I feel like they are making that appointment for that day. So they're trying to be proactive. But this man, for example, I think that that's what I was trying to use his example for is that I think once he learned more, he's like, oh gosh, I should have come in before. Like you could tell he was kind of like,
Yeah.
oh, I wish I would have come to you before, Melissa. Like this would have been helpful to learn before because I could have been doing this as soon as my catheter came out. Right?
Mhm. Which is kind of the best time to
I know.
start is once that catheter is removed, like seeing someone that week afterwards. That's what you said, 4 weeks is when you saw the person. That was a couple weeks that could have been working on building up that brain muscle connection with the muscles that we are looking to get back online. Uh,
Yeah. And also too,
yeah.
like picture that you go home after this big surgery, and you're wearing a diaper, which you're, quite or big pad. And this is like a really like big adjustment that I don't know if a lot of like people know that it can be that significant, right? That you could be that wet. I don't think many people want to go to an appointment. Like it's there, it's a barrier to go. Whereas again, like if you know that you have something to work on, you have an idea of what you're going to work on. I think sometimes making that connection with someone after is harder than making that connection with someone before so that they could say, oh, Katie, like, hey, I'm here proactively. I'm going to have this surgery on this date, or I'm going to start radiation treatments this date, what have you. They've built a rapport with you. You're able to describe what to expect after, just like we would, prepare someone for like your knee's going to hurt. You're not going to have great motion. I'll show up. I'll help you get crutches. I'll help you get a knee brace, like that kind of thing. I think it's very helpful so that they kind of like, I just need to call Katie, right? Instead of, oh my gosh, I have to find a stranger to help like describe to me what I'm going to do about my saturated pads. I think that like that's
When
hard.
you're now feeling uncomfortable and stressed and
Yes.
not realizing that this is a very normal
Yes.
symptom in the
Yes.
start
Yes.
that can have really great recovery and success when we got those tools to use at home.
Yeah. So generally then, so obviously one of the things like we've already mentioned within if we're talking specifically about incontinence, like we're saying ideally, see someone before to build the rapport and get used to those muscles because you want to help that kind of external sphincter or that valve do the work of stopping your urine flow. Um, I don't want to go into a lot of detail around exactly how many exercises or anything, but can you speak a little bit, Katie, to like what should someone expect that like generally, because I you already mentioned like the importance of learning how to tighten the muscles. I think a lot of people don't realize the importance of learning to let them go too, because every muscle works better when it is able to relax. But can you speak a little bit to like what should someone expect for muscle training, like pelvic floor muscle training after like generally give a very brief description of like what the goal is.
Yes, no, for sure. I know we kind of talked a little bit about timelines and what kind of improvements you're expecting when. So after I would typically an ideal world, given time and access, be seeing someone about a week after, and then 4 to 6 weeks after, 12 weeks. It's around that 12-week mark that our goal is no pads are needed anymore. We have full control over the bladder. Another check in about 6 months later, and then a year later, it's that year mark that we for sure want to see bladder control is looking good. You're back to all those activities you want to be doing with that good control, and we have good erection quality at that year mark as well. Uh, Occasionally, I do get what we call the slow burners, where because of some of those nerve damage impacts, or if you were struggling with a lot of urinary tract infections, or you anatomically have a shorter urethra, it could take up to 2 years to start to see some of those changes and impacts. But training other muscle, we want to target the muscle that we're looking for. For bladder control, it is actually, not going into too much detail, it's actually three different muscles, one in each of the three layers of the pelvic floor that have to work together as a team to almost horseshoe action kink that
Mhm.
bladder to create that physical control. If we think of a muscle like our bicep, we want to be able to fully contract that muscle, make sure I'm getting my bicep, I'm not getting my neck muscle instead
Mhm.
doing the work. So I'm targeting something very specific. But just as important as fully tightening is, can we fully release and let go back to that resting position? If it's getting stuck in that top position of that bend, and we try and do another bicep curl, we're only really getting a small amount of that muscle that we're training.
Totally. I'll never forget. So that same man that I was telling you about, so he was really bummed about not being as dry in that window of time. And um but I had to tell him a few times because his personality was like, you tell me to do 50, I'm doing 750. Like that was kind of his personality.
Right.
And I had to tell him in so many different ways before he got it that you have to focus on letting go too. Because I said, I think part of your leaking, and again, it depends. We're always asking, Kay, if you're not dry, like when are you having those accidents? Because that tells you us a lot. Similar to like if you're getting knee pain at the end of the day versus early in the day when you get up, or maybe you're getting knee pain on the stairs versus walking downhill, things like that tell us a lot about why you might be getting knee pain. Same with when you're leaking, like when it's happening, how much do you feel it coming out? That kind of thing tells us a lot about kind of what the quote unquote issue is. And this gentleman, like it was definitely a fatigue thing. So it was a leak more at the end of the day. And I I said, just trust me on this. Like if I'm wrong, I'm okay with that. But focus on letting go. Like just try that. Focus on letting go. And in this particular man, I had never done a rectal exam. It just wasn't something that he was interested in. And I said, would you be willing to try this? Because I think my feedback would provide you with my finger as feedback would provide you with that information that it's holding on for dear life. And you thought you had a weakness, but I think you have a fatigue issue now. And sure enough, after that feedback and working on the relaxation, he sent me an email. I've been the driest I've ever been. And I think that again, like that's the importance of like understanding the muscle has more to it than just tightening it, right? The ability to relax, the ability to tighten quickly, the ability to hold tension at times. But um, yeah, it matters to us like when you're having the accidents, right?
Yeah, like you mentioned, the we sometimes see. I had one gentleman that was a spurty leaker,
Hmm.
so his sport was motocross,
Hmm.
and it was every time he tried to stand up quickly on the bike, it was this kind of quick spurt leak that he saw. So often we forget about timing and
Hmm.
speed of the muscles
Hmm.
too.
Hmm.
And that's really where our approach to strengthening has changed over the years as well. Instead of focusing on just those long hold marathon running fibers that are kind of on in the background, doing their thing. There's also the quick ones that need to come on when we're about to cough, sneeze, stand up quickly on a bike.
Mm-hmm.
That can be just as equally important and frustrating.
Katie, when do you talk to people about clamps? Like for incontinence?
So I know Joe Milios is a physio that's talked a lot about this area, and she's a big advocate for using penile clamps. So a clamp that goes at the base of the penis, almost acting like a physical stopper.
Mm-hmm.
Um, when like you said, there's different kinds of leakers. There can be that really constant one throughout the day that you don't really feel happening. There's not really a driver or a connection. That's often more of a storage problem with the bladder. So, particularly some signs that we see even before prostate cancer is that kind of more overactive bladder where we're peeing often. We never really get used to filling up the bladder. So it never gets used to actually filling to full capacity. So as soon as there's a little bit of fluid in there, it's just going to drip right out. Particularly since we took away that automatic control and now we're relying just on those pelvic floor muscles. It could be a helpful tool in the beginning to be able to start filling up the bladder while you're working on all the other good training, all the other good homework at home. And it's not a long-term thing. It is a short-term temporary solution. Um, Having a full bladder is also an important tool for training too. Our bladder does act like a weight onto the muscles. So our muscles are going to respond to ways that we stress them or train them. If we only ever work on squeezing them when we're lying down our back and gravity's not working against them, they're only ever going to work when we're lying on our back. So being able to fully fill the bladder can add as an extra training tool to build up that extra power and strength in the muscles.
Yeah, great
I
point.
actually had one gentleman. Yeah. Oh, sorry. Go ahead.
No, I was just gonna say like great point because I think some people get in a habit of doing it like in their lazy boy recliner, and I think like it's important to be doing kind of like the more because most people don't leak when they're laying down. It's more kind of like in upright positions or when they're doing activity. So great point that like the need to progress into harder and harder positions. I didn't mean to interrupt you. Go ahead.
Oh, no, I was just going to say I had one gentleman. So the penile clamps, they're actually tricky to find in Canada.
Mhm.
I don't know if you've run into this as well. They used to be more available and now can't really seem to find them as much here. So his solution was he actually wrapped toilet paper around the end, almost like a stop, because he wasn't comfortable having the really, really
The
thick
clamp.
pads and found, oh, I can get away with just a liner if I do this toilet paper wrap, especially when I'm getting out of a chair with all
Hmm.
that extra pressure pushing
Hmm.
down.
Interesting. Yeah, I think and everybody has different comfort levels, right? Like I had one gentleman that just wanted to use the clamp. He was going to an event and he's like, I want to be dry for this event or, and so yeah, it's an option, right?
Yeah, it's
And
definitely
it's
an
an
option that's out
option.
there.
Yeah.
Yeah.
And so I think
Especially,
like
I was going to say, like, especially skiing, being a big activity here, a challenge with the pads, if they're wet and you're out in the cold,
mhm,
it's going to be a very, very uncomfortable skiing experience. So, like, having those
absolutely.
extra tools and supports while you're working on building back up to that strength that you need.
Absolutely. But I think like overall one of our big take home message for like the incontinence is that um like it's a symptom after a surgery, just like pain after a knee
Mhm.
surgery. And so there's a lot that you can do about it. And I think people are starting to get more and more information about physiotherapy, but I think one of our big take homes is like you don't need to wait till after, right? Yeah. Yeah.
Or try and suffer through it, and then you're not seeing someone to that year mark when we are expected to have
Yeah,
good control at that point. Yeah, so
absolutely.
much we can do earlier on.
So let's say then that someone's bigger, or not bigger, but maybe an additional symptom or something they want to address is the erectile dysfunction. So can you talk a little bit about like explain again, we talked about the incontinence and that the biggest mechanism there is that the internal sphincter has been injured or not there, and we need to learn how to recruit muscles different. Can you speak to the mechanism around the erectile dysfunction in a little bit more detail? And let's talk about what we might do as physios for that.
Yeah, I was actually just thinking that when you were mentioning scarring and tension being an issue as well, which I can delve more into in a second. But essentially, with erection, so if it's a surgery route, there actually some injury or damage to the nerves that direct blood flow into the penis. Radiation, we get a similar injury to nerves and arteries in the area, so it's also going to impact blood flow into the penis. Uh, One thing I never knew before delving into erections is there actually is two parts to erection. There's that vascular or blood flow piece. That's the one that you're working more with your medical team, trying to get blood flow into the spongy tissue. So things like PDE5 inhibitors are shown to be really helpful starting immediately to work on getting blood flow,
Can you give examples of
which is
those?
a sorry
Yeah.
fancy name for Viagra or Cialis. So all things that are just meant to direct the blood flow into that spongy tissue, help with getting an erection. The part where physio plays a bit more of a role is we often don't think about the muscular phase of an erection. And that's where there's certain muscles in the pelvic floor that contract or tighten to put pressure on the vein in the penis. So that's what really creates that rigid erection or that good quality erection that we're looking for. Uh, After surgery, we get that muscle atrophy that happens right away from not using the muscle. Uh, but just like if we broke our arm and our arm's in a cast, as soon as we take the cast off, our muscle is going to be a little bit smaller than the other side. But with targeted strengthening, we can build that muscle back up to where it was and have it functioning in a very similar way.
Totally.
Uh, yeah.
Katie, wouldn't
One
you
thing that
also
I
say,
think,
sorry
oh,
to
sorry.
interrupt you, but on that
Yeah.
note, wouldn't you also
Mm,
say that like some of the like tension from stress and like all that is kind of like when I'm listening to that, I'm like, oh yeah, weakness, but also almost like the number of people that I would say almost like have a holding pattern or like a tendency for tension down there because it's like a stressful area, that it's almost like again two parts to that, right? Like, and just knowing that of course you have like issues with this, right?
that is exactly where my brain was just
Yes.
headed.
Sorry,
Uh,
go.
yeah, no, I was like, we often think about just the strength part, but there could be that tension that is restricting blood flow into the penis or preventing you from being able to fully recruit that muscle to get that rigid erection. And if we think about all the scarring from surgery or radiation, and then you throw on all the stress of having gone through surgery, radiation, and the stress of just cancer experience in general, those muscles could be in that very tight protective state, uh, which is also going to stop us from having an erection. In those scenarios, if we're focusing on tightening the muscle, we actually might be making that erection quality worse. So one tip I usually suggest is um, if you have an erection and you try tightening the muscles or doing your Kegels, does that improve the erection quality or does it worsen it? Does that tightening bring you closer to arousal climax or does it start to take you away from that feeling? Usually, if it's worsening that quality or worsening the symptoms, that's where we might be suspecting, okay, maybe this is an overactive muscle or tension scarring issue that what are some other exercises or things we can approach or add in instead?
Totally. And I think like again, especially when you explain it like that for them to understand like this is a muscle coordination issue, right? And
Mm,
so and again, I think nobody's surprised if it happens in a different body part, but like we do not think about erection in much detail normally. It's such a like physiological response that we're not used to thinking we have control, I think. Right? So I think kind of explaining to people like actually you have a little bit more to do with this than you think, right?
Yeah. It's like just like the bladder control, we're expecting it to be that automatic
Yeah,
response. We've
exactly.
now taken away that automatic piece. How do we get it back to that?
And so would you say then, Katie, like you're kind of again, we probably would start with, and I always think this is the we as physios like want to meet people where they're at. So when they come to see a kind of quote unquote pelvic floor physio, they're expecting to get some pelvic floor education and pelvic floor exercise. So I think like what you're saying here is there's so much overlap between what we're working on with the incontinence and the muscle control for incontinence. It spills over to the benefits of muscle control for erectile function, right? Like we want you to know how to tighten and how to relax. Right. That would be, it sounds like that would be one of the first things that you're helping them feel and understand and work on is just like the control of those muscles and the coordination of those muscles. Correct?
Oh, definitely. Yeah.
Yeah.
Yeah. So being able to, can we fully tighten? Can we fully let
Yeah.
go? There's going to be definitely overlap of certain muscles in the pelvic floor. There's going to be other ones that are also involved a little more in the erection.
Yes.
Kind of like if you're strengthening your quad muscle, there is four muscles. They're all going to work together to straighten your knee. Depending on what our goal is, though, we could bias our brain attention to one more than the other
Yes.
with what we're working on.
Katie, how often so I'm finding that before I bring it up, some of these men have already heard about penile pumps. Like, that maybe their urologist has told them, or maybe they have found out about it on Google. Can you talk a little bit about what a penile like pump would be for in this example?
Yeah, so vacuum erection devices or pumps, uh, they're another tool that is sometimes recommended for that vascular piece or that blood flow piece. So the how do we start to get an erection? Particularly, I'm finding after radiation therapy, because often with radiation, we're not seeing the effects immediately. It's a bit of that delay as that scarring is developing over time. We're finding it's much easier to tackle the symptoms before that scarring starts. So I know one side effect we didn't really mention or talk much about is the penis can actually shorten
Hmm.
both following radiation with the scarring or following surgery because of the scarring as well. So if we can get ahead of it with something like a penis pump, which is basically just going to bring blood flow into the penis, it's a tube that goes over top. That gentle stretching of the nerves and bringing blood into the area can help with trying to keep that length a little bit more. Um,
And
I had a thought in my head and now I forget it.
would you say that like would you say just roughly, and again, this is going to depend on the person, but can you just give people a rough idea of how often they would use that?
Yeah, so typically it's recommended. So if you're using it more of a rehab tool, not for penetrative intercourse or sex, usually about 3 times a week is what we're doing to start to bring blood flow into the area. Um, Normally, we have erections that happen spontaneously at nighttime. So we tend to get usually 4 to 6 erections at night that we call sort of our housekeeping erections. They're the ones that are keeping that nice, good blood flow, keeping that good length. So after surgery radiation, we're actually losing about, what's like 1,500 housekeeping erections in the year. So having more of that kind of maintenance routine if you're using as a rehab tool, it's more just pumping it up to the length of erection that you would have before the surgery or radiation. I find one error we often do is we try and go
Make it bigger.
beyond what our normal length was, which is going to stress and potentially injure some of those tissues. So that's my one: go slow, go gentle, keep it to where you were. And then you could use things like rings to keep the blood flow if you are using it for intercourse, or it's just a pump it up, let it go, pump it up, let it go.
Hmm. Can you say then, so would you, um, I wouldn't, as a physio, I want clearance from like the surgeon or the doctor first. So I
Yeah.
would never say, now I say start using it. And most of them are, I think, are hearing about it now. So
Hmm.
how, when you say early, what would you say, what does early mean for that? Like, again, I want people to get clearance, but just what does that mean early?
Yeah, we do want that clearance, and it is going to depend on what kind of treatment approach they had, what their specialist is recommending. But we are finding, especially for actually even for surgery and radiation, that starting right away to get that blood flow is having huge success in getting that recovery with erections in the long term. We're finding if we wait too long, we've almost missed that window. And now we're getting some of that scarring happening, and we're working through breaking down scars rather than just could we have prevented it to begin with.
Totally. And don't
Yeah.
you think too, like playing around with something like that or figuring out how that works before you have a big surgery would maybe also have a little bit less of a barrier. Like I personally could say that I would be less nervous figuring it out before than trying to fill in an area that you're probably feeling nervous about post-op or post-treatment.
Yeah, especially because surgeries are scary
Yes.
too. We're not going to be comfortable adding something new that also might be kind of scary into it. So yeah, the more we can do before surgery and even before radiation as well, is just one less new thing that you're navigating at a time.
It makes me think like,
And
go ahead.
oh, I was just going to say one thing that I've been asked about too are certain types of pumps as well, because you can find them in the sex shops here.
Mhm.
There's definitely going to be a different in terms of quality that
Mhm.
you're getting from the sex shops versus more of a medical standpoint.
Great point. Because I was going to say, I think if it was me, especially because I feel like people want this information from their surgeon or their care
Mm.
provider, ask like your care provider will have heard about like your surgeon, your doctor, they will have heard about all of this before. So ask them because I think that they'll all have different preferences or ones they're used to using, and I
Mm.
think most people feel comfortable if they get that recommendation from a trusted source. And so don't hesitate to ask your provider before in an appointment before your procedure or your treatment, like, so just so you're thinking about it, you know where to find it, maybe you even purchase it before and try it, but I think that you want that information from a trusted source, right?
For sure, yeah. Knowing is this going to be a helpful tool for me based on what they've experienced before? Or is their surgeon maybe recommending more the Viagra route as well, or combine them together?
Yes.
It can have really great success.
So it sounds like what you're saying is that using something like the pump can help with not developing as much scar tissue, which would make you think like less chance of something like peyronie's or that curvature. What if someone already has peyronie's and they're hearing about the pump after the fact? Any guidance or suggestions there? Any hesitations?
Yeah, pump can be a great option. Challenges depending on the type of curve and where it is it going to be comfortable to use? Is it going
Mhm.
to fit well? There's actually more research and great success going into kind of hands-on physio treatment, working on areas of scarring. Also, ultrasound is something that we've been using often as well, and that's been having some really great success and results. I think too, there's some newer research. The shockwave
Yes.
therapy is
Hmm.
starting to become a bit more popular. I believe there's one spot in Kelowna that is doing it. It's still pretty new, but does seem to be kind of on the promising side as an
Hmm.
option.
I
So
think
there's lots of tools that are out there.
And that's the thing is I think it's important to point out that if you come see someone like us, we're not going to say you have to do all of this. Sometimes I think of it as a menu, like, here, let me tell you about all these options. I'm going to talk to you about your muscles for sure. I'm going to talk to you about like better recruitment of your muscles and help you understand your body. Like that's kind of a given. But as far as like a clamp goes, a pump goes, and when you said like hands-on treatment, I think for a lot of people, I think that would bring a lot of nervousness. Like I picture that, like I literally picture like if this was my dad and he had like a curvature and needed to go see someone that was his daughter's age, he would probably kind of be like, oh my gosh, this is so uncomfortable. And for those reasons, I mean, sometimes it takes a while to build a rapport with someone. We're always going to be talking anatomy and giving you reasons why we would be able to offer something like that. But at the end of the day, it's your choice. And don't you think, Katie, like there's always those people that have some more comfort than others, but there's always people that we're teaching them how to do it themselves, right? And just like, okay, well then let me describe to you. I don't need to touch you. If that's not helpful for you, I'm not gonna make my you don't have to do that. Let me describe to you or let me show you what structures you're going to be working on, or maybe your partner wants to work on this with you. But options, 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 right?
Oh, definitely. Like there's so many different ways to approach it, and depending like, what is that person's goal, what are they hoping to get back to, we want to give the people we see all the tools possible that they can do it on their own, that
Mm-hmm.
they don't have to come see us again and again. There might be cases where you might see this too, where maybe only seeing someone once
Mm-hmm.
or twice,
Mm-hmm.
but it's the tools you have to do at home that's going to be that really big important piece.
Absolutely. And I think also too, like we obviously have to bring up at this time, like one of the barriers to seeing someone like us is you have to pay. We are not built into the healthcare system at this point anyway. And so, I mean, extended medical benefits help that. But when we talk about all of these options, like we will always be having that discussion with you around what do you want to get out of this. And lots of people say, you know what, Melissa, like I can afford to come once, or um
Mm.
I want to come as many times as I can because I get a lot out of it. And I can't say enough how this is one of the reasons I do this podcast, is so that like this can almost save you an appointment here just by
Yeah.
understanding like what you're going into, what questions to ask, directed questions to ask your provider, what you could, ask to get from your physio. Yeah. I mean, I think like just knowing that this is for you, this treatment process is for you. We don't have an agenda. We don't have a certain number of appointments you have to come.
It's
Hmm.
not a cookie cutter protocol of you
Hmm.
have to do
Hmm.
this
Hmm.
every week,
Hmm.
many
Hmm.
weeks. And my dad's going to hate me for mentioning him because he doesn't have physiotherapy coverage.
Hmm.
And going through that classic as you're aging, then going to the washroom often, urge to be getting up at night to the point where I haven't seen them since I moved here because they can't get on a plane to fly because the symptoms have been so limiting. And
Hmm.
I've had so many conversations mentioning like pelvic floor physio is
Hmm.
something that you don't have to go for all these sessions. It
Hmm.
could just be one appointment. It doesn't mean they're going to do an internal rectal exam too, or something
Hmm.
that you're not comfortable with. Like having the knowledge and options of things to do that can get you back to traveling and doing what you want to be doing.
Absolutely. And I always say, like, at the end of the day, picture two people that, have a knee surgery and they're both given the same option. Hey, would you like to maximize your motion and strength before and build a rapport with someone that's going to help you walk through the recovery process after? Or do you want to just have this card and call along the way if you need? Like, you have choices, right? And I think it all depends what you want to get out of your quality of life and, you know, your choice. But I think a lot of people can make the realization that if I like the knee surgery by itself is helpful, it's the recovery of the your walking and your motion and your strength and everything that could make the difference for your long term well-being and your ability to play sports or what have you. And it's not that different in the pelvis, right? And like the removal of the prostate or the cancer is one thing, but the surgery or the procedure itself um, doesn't make your muscles more coordinated or doesn't
Yeah.
guarantee that your function is 100%.
Yeah. Like you said, with the knee function and even something erection function is just another
Hmm.
symptom
Hmm.
of, okay,
Hmm.
muscles aren't functioning the way we want them to be.
Hmm.
And that's that particular symptom that we're seeing in this case.
Hmm.
And I think it was something like if you're over 60, only 4% of men will get back to their pre-surgery function without any intervention. I think it was
Interesting.
maybe something like 23% will get their function back if we just leave it, do nothing. That's just a natural recovery. So, like, even a little bit of can we start this early? Can we add some things in that are going to improve the function of those muscles? Can get you back to that good quality erection.
Totally. And also too, like if you've had a knee surgery or if you know someone that has, you know what to expect from the surgeon. They're not going to give you exercises. Like that's just not going to be, they're going to do the surgery. They're not going to give you the exercises. And I think sometimes we go into some of these procedures or surgeries expecting to get everything, but every single member in the healthcare team has a different role, right? And not one person will give it all, right?
For sure, yeah. The surgeon's there to make sure the surgery is successful. That's their area, their expertise. Where I feel like we were more on the okay muscle side. How do we get
Mhm.
you back to what you want to be doing?
Mhm. I've heard the term before, like the physios are kind of the now what people.
But
Katie, anything that I haven't asked you that you feel is important to include in this discussion?
I feel I touched base on our two big symptoms of bladder erections. Earlier is always better,
Hmm.
but it is never too late to
Hmm.
address things if it is something that is bothersome and you're not where you want to be at that stage. Um, I'd say you're probably going to talk about this with the urologist, but getting the screening done early. That was one big takeaway when I joined the prostate cancer group for their chat was the earlier we can detect things, the better the recovery that we're seeing.
Absolutely. Actually, and I'll obviously make sure that your website and your information is included in the show notes, but I'll also make sure to include the prostate cancer support group link for our community in the show notes too, because I think that whenever you learn that you're not alone is always very helpful. And I think these some of the people that you meet will have their own wealth of knowledge as to, people they saw in town that helped them or advice that they want to share with others. You can get a lot from those groups as far as, just learning you're not alone, like I said. Yeah,
Yeah, the more we share and the more knowledge we have, definitely the better the outcome.
absolutely. Well, thank you so much for joining me today, Katie.
Oh, thanks
Appreciate
again for having me.
everything.